Hello, my name is Crystal Nguyen, and my presentation is on the Meningitis Project. My first patient, a 3.5-year-old named Tyler, was brought to urgent care due to a high fever and a loss of appetite. He attends daycare 5 times a week and has no known vaccinations. Upon a physical exam, I noticed he had stiffness in his neck. Because of the possibility of meningitis, a lumbar puncture was performed for a cerebrospinal fluid analysis. By comparing the CSF of Tyler's to a normal CSF range, I noticed that he had decreased levels of glucose, less than 40 milligrams per 100 deciliters, showing evidence of bacterial meningitis. His protein levels were also greater than 100 milligrams per 100 deciliters, another indication of bacterial meningitis. Thus, his CSF samples were sent to the lab for testing, and these were the results that I received. The gram stain displayed a pink color indicating a gram-negative Coccobacilli. The endospore test came back negative, which ruled out the Bacillus and Clostridium genus. The acid-fast stain was also negative, ruling out Mycobacterium. There was no signs of growth on the nutrient or blood agar plates, but signs of growth on the chocolate agar plate, so this organism is fastidious. In the McConkey's agar, as well as the eosin methylene blue agar, the plate remained colorless. This showed no growth and the inability to ferment lactose. I was able to cross off Escherichia coli off the list. And lastly, the Thyre-Martin agar displayed no signs of growth, also meaning no signs of Neisseria bacterium. By using the process of elimination, I have concluded that my patient has Haemophilus influenzae. This is rare in children and is prevented through vaccination. Tyler did not get his Haemophilus influenzae vaccine, so it is necessary to treat this infection as soon as possible with antibiotics for 10 to 12 days. The most common types of antibiotics are ceftriaxone and ampicillin. To help with the inflammation, corticosteroids may be used. If the patient has trouble breathing, he may also use a breathing support. Isolation is necessary for the first 24 hours after the start of antibiotics. As for the prognosis, if he is not treated, he may have brain damage, hearing loss, or the risk of death. The earlier Tyler is treated, the better his chances are to a full recovery. My second patient, a 2-year-old named Jenny, was brought to the emergency room with symptoms of a fever, diarrhea, and the start of a rash. She was also sensitive to light and resistant to moving her neck. Upon a physical examination, her trunk, hands, and elbows displayed some lesions. Because of the possibility of meningitis, a lumbar puncture was performed for a CSF analysis. By comparing the CSF of Jenny's to a normal CSF range, I noticed that she had low levels of neutrophils, being 33%, and normal to reduced levels of glucose, indicating viral meningitis. Her protein levels were slightly elevated than normal, another factor of viral meningitis. The symptoms that stood out to me were sensitivity to light, appearance of a rash, and the skin lesions. Based on my patient's symptoms, I ordered 3 serology tests: West Nile virus, measles virus, and echovirus. The serology for West Nile virus indicated that the patient has not previously had the infection nor immunization. She also does not have the infection now. The measles virus testing results were IgG positive, meaning my patient has been vaccinated for measles or had a previous measles infection. The test also showed IgM negative, which means there is no current infection. Lastly, in the echovirus testing, there showed no signs of previous infection nor immunization, as stated in the IgG negative. But the results IgM positive indicates my patient currently has the antibodies for echovirus and has an active infection. The treatment for echovirus is very minimal. Usually the infections are self-limited and requires no specific therapy. Medical treatment can be used as supportive care. Intravenous gamma globulin therapy has been used to treat immunocompromised patients with persistent echoviral infection. However, the role of IVIG therapy for acute infections has not yet been proven. Jenny should stay home and get some bed rest. To reduce the chances of spreading the virus, she should wash her hands and avoid hugging or sharing utensils with the people around her. Also, it is important to disinfect the surfaces of her toys, doorknobs, or anything she comes in contact with. As for the prognosis, in some cases of severe echovirus, it can lead to infections of organs such as the heart, and consequently causes even more severe diseases. Luckily, those who have a less severe type of echovirus meningitis should recover completely without treatment. To conclude my presentation, I hope everyone has a great day, and remember to get your vaccines and to wash your hands. Thank you.